We begin at 11 with another pandemic milestone in Virginia. The Commonwealth reports 3 out of 4 adults are fully vaccinated against COVID-19. 85% have had at least one dose.
But are those vaccine numbers enough to reach the herd immunity we talked about months ago? Angelique Arentock got answers from a medical expert.
UVA Health Assistant Professor Dr. Patrick Jackson says herd immunity isn't so cut and dry when it comes to COVID-19. In the early stages of the pandemic, health experts hinted that vaccination rates between 70 and 80% would get us to herd immunity. But Dr. Jackson says being vaccinated and being immune from infection aren't necessarily the same thing.
Especially with the Delta variant, it's more transmissible than we had thought before. And while the vaccines are highly effective at preventing things like being sick enough to go to the hospital because of COVID-19, they're less effective at preventing transmission. Probably you'd say that you'd want somewhere in the neighborhood of 85% of the total population to be immune to COVID-19 to really achieve herd immunity. And that includes kids as well as adults.
Virginia isn't quite there yet. Dr. Jackson says the vaccination push should continue. While 75% of adults in Virginia are fully vaccinated, only 63% of the total population in Virginia is.
One thing that we have seen internationally is that in places that have very high rates of vaccination is that while cases might go up, the number of hospitalizations has not risen nearly as much, which I think is a really encouraging sign about the benefits that we're getting from vaccination.
And with the possibility for a winter wave of infections, Riverside infectious disease specialist Dr. Rebecca Sensenig urges masking, social distancing, and crowd consciousness to also continue.
We can't let our guards down 100%, even though the vaccine is available. We still have to be careful.
Angelique Arentock, 13 News Now.
Now that children can get the vaccines, here are the dates to know so your kids will be fully vaccinated by Christmas. Take a look at this timeline behind me. Remember, kids aren't fully vaccinated until 2 weeks after their second shot. So the last day your child can get their first shot right there is November 20th. That's a week from tomorrow. For Pfizer, the wait time between doses is just 3 weeks. So your child should get the second dose by December 11th, 2 weeks before Christmas, which is again how long you'll need to wait for the vaccine to be fully effective. But what about Thanksgiving? It's coming up quick. Dr. Sensenig of Riverside Health System says if you plan to celebrate with people, it's important to take precautions.
You know, they're not fully vaccinated. They don't have full antibodies, so they still need to take precautions. So they still should be masking when they're out in public. They still should be careful when they're indoors with people, especially if other people aren't vaccinated as well. They have some protection after the first dose, but the full protection is until 2 weeks after the second dose.
The same timeline is true for adults looking to get the Pfizer vaccine. For adults getting Moderna, the time frame between 2 shots is 4 weeks, not 3. So you need to get your first shot by tomorrow to be fully vaccinated by Christmas Day.